how we manage or plan a hair transplant in a grade 6 Norwood male pattern baldness. So today we have a 26-year-old male here. He has a very strong family history from both father and mother, that is paternal and maternal side, in male pattern baldness history. He started losing his hairs at a very early age of 16 years. He took some treatments which were not very effective. Hair loss continued and progressively increased from grade 1 to 2, and currently it is a grade 6 now. Why it is a grade 6? Because you can see in the pictures on the screen that his humps are preserved and there is still some thinning zone in the back side, so it can progress to the grade 7 male pattern baldness also. Now what do we do when we see such a patient? The first thing is we take a detailed history of a patient, ask him about family history he has. We also ask him about his medical problems if he has, and he has an allergy to ibuprofen. So during our procedure we will be very cautious that we will not use this drug because he is a known case of allergy to a particular drug. Then we will use some substitute for that. So when he came for planning part in our OPD, we did his trichoscopy, and in his trichoscopy we found out that his majority of the hairs were terminal. His terminal is to vellus ratio was well maintained. It was almost 90 to 100% in different areas of the safe donor site. His density also varied from 83 to 84 follicular units per centimeter square in various areas on the safe donor area like occipital, left and right parietal, upper side, lower side. His hairs per follicular unit were also very high. They were 2.1 hairs per follicular unit, and average density of around 83 follicular units per centimeter square. Average thickness of hairs was around 0.084 millimeter, that is 84 micrometer, which is quite high. His coverage value is again very good. It was 14.6, which is again a very good sign. But the thing was, his donor area was limited. It was around just 5 centimeter wide and around 28 centimeter horizontally. So this was around 140 square centimeter, coming at an average density of 83 follicular units per centimeter square. He had around 11,600 grafts available in his donor site. When we planned the marking, we planned a coverage up to the transition zone, slightly beyond, not the crown part, the lower crown or the zone 2 of the crown. We are not doing. We are doing the zone 1 of the crown and up to the transition zone, slightly beyond that. This entire area was around 150 centimeter square. We planned a differential density concept here where we are going to give him 40 follicular units for the front area in the hairline, 40 follicular units per centimeter square, and for the rest of the area we are planning a density of 32 follicular units per centimeter square. So his requirement comes to around 5,350 grafts for the front and the mid scalp and the upper part of the crown as well. If we try to take out these many grafts, we are going to extract just by FUE. If we plan it out, that means that we will be taking a lot of grafts and this may lead to a lot of thinning in the donor side. So what are the alternatives? First thing is the beard. Beard we did, it was okay but not very good. Scalp to scalp is the best donor side. Beard is always the second preference in the terms of hair transplant. So thinking this, we have planned combination of FUE and FUT in this patient. So we are going to take out graft from the scalp, so safe donor area, by a combination of techniques of FUE and FUT, so that we have the same natural hairs from the same donor site, and at the same time we are not transgressing the boundaries of the safe donor area. So in his case we are planning a combination technique here, which is also well documented. Friends, I would like you to be beware of people or doctors or clinics who degrade one technique and they know only one technique, whether it is FUE or FUT. The best doctors or the best surgeons, they know both the technique, they do it wonderfully, both the techniques are performed nicely. With this in mind, we planned a FUT and a combination of FUE. We will be sharing with you the marking of the FUE and FUT also in the donor site, so that you know. We will be measuring the laxity in the donor site, and then strip if it is not too wide. Maximum strip width we keep is around 1.2 to 1.5 centimeter in the middle, and gently taper it off towards the sides above the ear or the post-auricular region. That's how we plan it out. The hairline which we have planned out here, because it's a grade 6 and may move to grade 7 also, is at around 7.5 to 8 centimeter, which is slightly mature, but it is going to decrease our requirement. If we just bring it down by around 1 centimeter, then we will need 400-500 grafts extra. So to prevent that, and the hairs, they always fall forwards. So even if we are keeping it around 7.5 centimeter, they are still going to fall forward by around 1 centimeter. And then if we are slightly above, we can go till a reasonably back side just beyond the transition zone. So with this in mind, at 7.5 centimeter hairline, which is gently curving superior and creating a sort of a widow's peak here also, that's how we have planned out. And we have created these micro and macro irregularities here. These are the micro irregularities and macro irregularities we have created here. We have already done his blood test. When he came for the consultation, they were all okay. We have done his sensitivity test. We have done the ECG. We have tested the sensitivity to the antibiotics as well. And now we are just waiting for the procedure to start, and we'll start it in the next couple of minutes. We will be sharing a few clips of the procedure also for you to understand that there is a complex way of planning, and this planning in each and every case has to be customized. Same planning does not work for every grade of baldness, every age of baldness, and we have to look at a lot of factors before actually planning a procedure for any patient. That's it for today. If you have any questions or queries about how do we plan out our hair transplant, you can mention in the comment section below or call us at the number given on the screen. Also, if you or somebody from your family is looking how to plan out a hair transplant, you can share this video with them. If you want to see how your results are going to look like after a hair transplant, in the comment section we have our artificial intelligence based app which gives a prediction of the kind of results you can expect after a hair transplant. We have a lot of other videos covering grade wise baldness also, so there is an entire list of videos which you can click on the left side to see. And if you want to see one of our latest patients results, you can click the video on the right.